Hi all, I am Dr. Sneha Deshpande, working as a senior consultant at Momstory. So today let's discuss about how to track ovulation or to know about fertile period. So for knowing this, basically we should know something about menstrual cycle. So on an average, females will get menstrual cycle of 28 days, which may last from 21 to 40 days, but for common purposes we will consider it as 28 days cycle. So your menstrual cycle, which is happening every month, is controlled by one small gland in your brain called as hypothalamo-pituitary axis. So it will control your ovarian hormones, and which in turn will form lining of uterus. So first half of cycle of your period, like first 14 days of your cycle from day 1 to day 14, are mainly controlled by estrogen. During that phase, what happens? Because of estrogen, many follicles start developing. Follicles means small eggs start developing. Out of that, one will become dominant, which is called as dominant follicle, and it will release egg during mid cycle, that is called as ovulation. So this ovulation is very important for pregnancy to happen. When egg is released from ovary, it has a lifespan of 12 to 24 hours. So that is crucial period. And once ovulation has happened, body will prepare bed for that pregnancy. So second half of cycle is governed by progesterone hormone, which will make bed or endometrial lining stable in the uterus. So if pregnancy happens, then pregnancy is supported by progesterone hormone. But if pregnancy does not happen in that cycle, then female will get period, that is shading of lining. So this is happening continuously throughout year. So why it is important to know about ovulation? As I told you, once egg comes out of the ovary, it has a lifespan of just 12 to 24 hours. So that period is important, because if fertilization happens during that phase, then only pregnancy can happen. Sperm has lifespan of 3 to 5 days. So relations which are kept before your ovulation are equally important. So while tracking ovulatory period, we need to focus on the window of fertilization. So usually it starts 4-5 days prior to your day of ovulation, and it will be till the day of ovulation, and one day more than that. So while tracking ovulation, few basic things we should understand. So there are some physiological changes happening during that period in your body. Like at that time, some female may develop crampy discomfort in the lower abdomen. Some may get slight spotting, that is called as Mittelmer's phenomenon at the time of ovulation. Most of the females will get clear straw colored discharge, which will increase, like thinning of that cervical mucus will happen at the time of ovulation. Female will feel more libido during that period because of the estrogen surge, and there can be increase in the basal body temperature at that time. These are some physiological changes which we can monitor and get vague idea about timing of ovulation. But just knowing about these symptoms won't help, because sometimes you get these symptoms or sometimes you may not get this symptom. So while tracking ovulation, if your cycle is of 28 days, you need to subtract 14 from that so as to know your day of ovulation. And you should try 2-3 days prior to that day on alternate day, and 1 or 2 days after that. So usually it is window of around 7-8 days, during which you can try at least 3 times. So that will, if you try during this phase of window of fertilization, then chances of pregnancy happening are 8% in this way in one cycle. So almost 50% female will conceive in 6 months period, and if ovulation is tracked properly, almost 80% females will conceive in 1 year period. But if it is not happening naturally, then we need to track ovulation in different ways. So how it is done? There are some kits which are available commercially as ovulation kits or LH kits. So that will give us idea about ovulation. So LH is one hormone which is secreted by your pituitary gland, which will rise just 12 to 24 hours prior to ovulation. So it is urine test which will give you 2 lines as a ovulation day, and you need to try from that day and continue for 1 or 2 more days so as to get fertilization to happen. So that is about LH kit. If it is not happening for 4 to 6 months, if you are trying naturally, then ideally you should seek advice from your gynecologist. She will advise you to go ahead with a ovulation study. So what is ovulation study? Ovulation study, these are sequential sonographies which are advised. They can be done through vaginal route or sometimes through abdominal sonography. In that, we track both the things, how endometrial lining or uterine lining is formed, and we track how eggs are growing. We say those eggs as follicles, and usually on an average eggs start growing at the speed of 2 millimeters per day, and at the time of ovulation, usually after 18 to 20 follicle will release egg or ovulation may happen. So we can track that if we get difficulty in trying naturally. So these are common methods which will give us idea about ovulation and will speed up our chances of getting pregnant. So if you want to know further about this, you can contact us at Momstory. Thank you.